Ever felt overwhelmed by the complexities of navigating Medicare Part B employment and existing health insurance? Let's break it down. Medicare Part B acts as your medical insurance, covering doctor's services, outpatient care, medical supplies, and preventive services. While some are automatically enrolled, others must decide on the right time to jump in, especially if they already have health coverage. So why would you consider postponing Medicare Part B? Well, if you're actively employed with comprehensive insurance from your employer, you might not require the additional coverage. Plus, holding off on Part B could save you some pretty pennies on premiums, especially if your current employer coverage satisfies your needs. Eligibility to postpone revolves around two main factors: active employment and employer size. If you or your spouse are actively working and your employer, with 20 or more employees, provides your health insurance, you might be eligible to delay enrollment. With a clear understanding of your current coverage and the benefits of Medicare Part B, you can start evaluating whether postponing is the right move for you. The process of postponing Medicare Part B can seem daunting, but it's manageable if broken down into clear steps. First, thoroughly evaluate your current health coverage. Compare it with what Medicare Part B offers, taking into account aspects like coverage, deductibles, and out-of-pocket costs. Next, open a dialogue with your employer. Confirm how your current insurance interacts with Medicare and double-check that postponing Part B won't lead to penalties or gaps in coverage. A key concept to grasp is the special enrollment period, or SEP. If you delay Part B enrollment, you're eligible for SEP to sign up later without penalty, usually when your employment or present coverage ceases. Finally, if you're automatically enrolled in Medicare Part B, you'll need to inform them if you decide to delay coverage. Remember, it's essential to keep Medicare informed about your decision to postpone to avoid any unnecessary complications. Decided to postpone? Well, that's just part of the journey. It's equally important to understand how and when to re-enroll in Medicare Part B. Now let's talk about timing. After you or your spouse's employment ends, or your current employer insurance concludes, you enter a special enrollment period, or SEP. This period starts the very next month. It's crucial to remember this timing, as enrolling during your SEP helps you dodge those pesky late enrollment penalties that could inflate your Part B premium. So, let's say you've hung up your working boots, or your insurance has run its course. The ball is now in your court to enroll in Medicare Part B, and you've got an ace up your sleeve, your SEP. Make the most of this period, enroll without delay, and sidestep any penalties. By knowing when to re-enroll and how to avoid penalties, you can ensure a smooth transition back to Medicare Part B when the time comes.